Today, we welcome to the program now Dr. Jennifer Bryan with the Mississippi State Medical Association, the Board of Trustees President Elect. Dr. Bryan, always good to see you. Thanks for coming in.
Oh, good morning. Thanks for having me.
Well, these respiratory illnesses are starting to get lots of attention. Of course, here in the United States, a couple of states in particular are experiencing what appears to be almost an epidemic of childhood respiratory illness. And then lots of reports again coming out of China as well. Hospitals being overwhelmed with this issue. What's going on here?
So it's multifactorial. I mean, first of all, we're okay. I think our biggest threat here is flu. COVID's running a second there, and lots of respiratory stuff this year. But the white lung stuff with the kids, that's not really a medical diagnosis term. It's just the way the pneumonia looks on the X-ray.
Okay.
We're seeing just a lot of respiratory stuff. I don't necessarily think it's connected to China, though. It's difficult to get information out of China. So,
and when you do, you can't rely on it.
Right. But what we're seeing are typical respiratory pathogens like mycobacterium, atypical pneumonia, the typical cold viruses, and flu and COVID. And so we are seeing these clusters of outbreaks. And it's what we've already learned over the past few years. People are coming indoors. It's cooler. They're breathing. They're coughing. So you're going to see these outbreaks. As to what's happening in China, from what we are hearing, it's mycobacterium and a lot of the typical pathogens there as well. And we could speculate as to why they're having more problems than we are with handling it. But nonetheless, I'm not overly concerned, but we are watching all of that.
Why children?
That's just who they target. Same thing when we talk about children and older folks when it comes to viruses. The adult human with intact immune system does the best. Children don't have as strong an immune system as adults, just like elderly. That wanes later in life as well, and particularly with medical conditions.
Well, I believe it's Ohio, right? It's one of the states which has reporting a number of children being hospitalized with this. What's the treatment?
So with Z-Paks still treat mycobacterium, but then depending on flu, it could be Tamiflu or Zofluza or the other antivirals. COVID, we still got Paxlovid. So it is a mix of what we're seeing. And of course, vaccines are the best prevention. They still work. They're still safe and effective. So if there is a vaccine for a respiratory pathogen, this is the time of year to be thinking about, have I had my pneumonia shot, if it's indicated, flu shot, COVID shot, and so on.
Gotcha. So in China, I've seen just some of the national physicians who comment on these matters have said that they believe this is largely the result of just the very harsh, stringent lockdowns they had during COVID. Now they're out and about, and so they were unable to build up these immunities by being out and about and I guess catching these diseases and then moving on, and all of a sudden this is all coming at once.
One of the things I heard you on the last segment talking about, when we were wiping down our mail and Amazon boxes, science is not real time, as you know, so we'll look back and we'll reflect on this and say, okay, this is what was happening in China versus Ohio or what have you. But that's a good theory. I mean, I agree that they did have much stricter lockdowns than we did here. We locked down or we slowed down for a time when we began to get tools, but we never did do what they did. And your immune system is a wonderful thing, and it's exposed to pathogens. It does begin to develop some immunity. So I agree that probably is part of it, but that's, again, just me guessing. I don't think we'll know until the end of this season. We really reflect back, and we may never know out of China. That's
that's a problem.
But it is a good theory.
Okay, but in general, you don't seem to be overly concerned about it here in the in our state, for example.
We have tools here. It's not anything that certainly we always pay attention. Really, the big threat right now is flu, and we are seeing a very aggressive form of flu. I do want to really kind of double down on flu, and if you have not gotten your flu shot, now is the time to do it. It's really aggressive this season, even more so than COVID appears to be, although there's plenty of COVID out there and still in the hospitals. We'll watch this. Things evolve, but at this point, the signs and symptoms just say this is a bad respiratory season with things that we know how to manage and treat.
And are the elderly and those with comorbidities, are they more vulnerable to the flu here?
Certainly, yes. The answer is always yes when it comes to respiratory illnesses and the elderly and those with chronic medical conditions. So you're thinking, diabetes or heart disease or, those things, cancer. You need to be thinking about, have you gotten your vaccines? Because unfortunately, it's going to affect your immune system and your ability to fight these things off.
Yeah, gotcha. So let's pivot a bit. How are things going in the world of medicine in the state of Mississippi? You being, of course, involved with the State Medical Association, I'm quite sure you hear lots of feedback from your colleagues in that world. What do they say?
Oh, well, thank you for that. We just had a board meeting last week. A lot of conversation around the state from all corners of the state. Looking forward to this new legislative session. Looking at the committee chair appointments. Looking at the changeover in leadership, particularly in the speaker position there, and just really, I think I sense some enthusiasm about the things that we can get done. There's been an eye on public health now for a while. We've all talked about, the elephant in the room that is just, our health care and what do we do about it and how do we take care of our people and what's going to happen with the hospitals. But I'm sensing a renewed interest and enthusiasm that we're going to be able to get some things hopefully accomplished that meet some of those goals. We're still looking at the same issues with, think about kratom and the substances of abuse there and how we kind of get a handle on that before that horse gets out of the barn every time and we end up chasing it backwards. We're looking at the prior authorization bill that previously did not go forth, but we're excited about, having another bite at that apple. And then, just again, looking at the Medicaid program, looking at the hospitals, and just really coming together. Lots of initiatives. I will say that this stopgap measure with funding the hospitals has been so appreciated and across the state seems to really be making an impact. Our physician practices can continue to struggle, but I am hearing that there's going to be more impact for the physician practices to keep them out of the hospitals in the first place with whatever we do long term. So looking forward to making a lot of that happen. Yeah,
and I know your organization represents, of course, and advocates more for the physicians themselves.
That's right.
But in the Hospital Association is a completely separate entity, but they're obviously integrated.
There's overlap.
Yeah. What are you hearing from the hospitals these days? I know they've got numerous economic challenges. What are you hearing lately?
What I just talked about the I think they're grateful, for what has been done, and then looking forward to how we fix this going forward. Yeah. I talked to administrator of a rural hospital just last week that was kind of expressing those sentiments about, they're kind of finishing in the red and they don't like it, and how do they take care of the people. And interestingly, too, this is a political tangent I'm taking, but heard from a nephrologist this week who he said, I'm taking care of a lot of people that are not from this country that have illegally come across the border or wherever, and they need dialysis. And so you have this person standing in front of you, and it's life or death, and dialysis is a very expensive thing. And so he says, we're filling up our dialysis chairs, and we're not getting paid for any of it. And I thought, wow, I haven't even thought about that being as big a problem in Mississippi as he said that it was. So, we learn something every day about how we're all being impacted by all these geopolitical things, and that was interesting to me.
Yeah, that is interesting. That's the first I've heard of that as well.
First I heard about it too, and I said, really? He said, absolutely. So I'm watching that. But I mean, I can't say if that's a trend, but those kind of things are impacting us as we're taking care of folks and using our resources. How do we get paid for those services that, you're not going to let a person stand there and
right.
So what do you do?
Yeah, and not getting paid for it. And I know it's a problem, and I hear it from the physicians, from the hospitals routinely, because it's a real thing.
Complex problems. We're also watching federally the Medicare payment cut. It looks like this cut's going to go through. It's going to be less than it was, and I think there's going to be an opportunity to make it up on the backside some, but physicians are the only ones not tied to inflation, and so the hospitals continue to go up and all the ancillary services, and we're not able to, and that has hindered us on the other side of COVID as well. So these are things we're working on, but ultimately the goal is to make sure that we're there to take care of the people, and these next few months should be challenging. Like I said, a lot of flu, but I think we're okay right now. We'll just continue to monitor.
Yeah, well, certainly hope so. No, always appreciate you coming on, Dr. Jennifer Bryan.
Hey,
thanks a lot.
For having me.
Yep. Folks, we're stepping aside for a break right here. We're in the Element Well studio, coming right back. Stay with us.